Hi everyone, Dr. Jeff back with you this week with Alexis, and this week we're going to talk about your shoulder.
Yes, we're going to specifically talk about shoulder impingement. So that's pain kind of up here in your shoulder. You typically find it comes on gradually. So you'll mainly find when you're lifting your arm, especially with your thumb pointed downwards, you'll feel some pain right up here in your shoulder. And then you can have a pain arc, which means it tends to be more painful in a certain range, like from around 60 to around 120 degrees. You might find extra pain. You also might find some clicking up in that shoulder, so when you lift it you might feel a little clicking sensation. So all those can kind of lead to pain and discomfort when you're doing that overhead motion. You also might find a little bit of weakness when you're doing overhead work, or just like pain, or like not able to do it for a long period of time.
Yeah, it can be very painful,
Yeah.
for sure. And generally with this is you've got four muscles in your shoulder called rotator cuff muscles, and you have the supraspinatus, the infraspinatus, the teres, and the subscapularis. We call it SITS for short. And the subscapularis is right here. The rotator cuff is designed to kind of keep your arm attached to your body so your arm doesn't fall off. And with that, you've got the clavicle at the front, which is kind of your collarbone, and it comes to a tip here. At the back, you have your shoulder blade. And your shoulder blade actually is free floating. It kind of sits on your ribs and rotates. And when you lift your arm up, what has to happen is the shoulder blade has to rotate in order for that canal to open up. And you have this big bump here called the acromion, which is on top of the shoulder blade. And what can happen when you lift your arm up, what can happen sometimes is that canal gets kind of tighter. The tendon has to slide through that canal, and it starts to get irritated, especially with lots of overuse. That's typically how this comes on. So people that work a lot over their head, electricians, plumbers, carpenters, whatever, sports people that do a lot of overheads like badminton or tennis, things like that. And again, that tendon is going to slide back and forth through there, and that tendon can get quite irritated. It starts to swell, starts to be quite painful. You also have a bursa sac sitting in there that lubricates that tendon goes through. Sometimes that bursa sac can also get inflamed, and that's a space-occupying lesion as it grows. And again, that tunnel gets smaller and smaller and smaller. If this continues on, you've had it for a while, that swelling is sitting in there. Sometimes we call it calcification or calcific tendonitis. So what can happen is the stem cells of that inflammatory condition can actually form bone. And when you're coming up, you start to get this clicking as that tendon starts to kind of pop through. So it kind of goes through, you're fine, and then it comes through, it kind of pops out the other side. And that can be that calcific deposit going through, or just a real thickening of the tendon going through. And again, that can be quite painful.
Yeah, so we have some tests we can do here at the clinic to help identify shoulder impingement, so we're going to go over some of those.
Yeah, so one of the most easiest one is the painful arc. So we can get the person to kind of, again, not straight out, a little bit at 45, get them to lift their arm up. And if they're getting to a certain point and say, oh, that's really painful, or they're starting to get quite a click in it, we know that might be something going on in there. We also, again, hold the arm here. I'm going to push on it. As Alexa mentioned, sometimes you'll get some weakness with it, and I can push the arm right down. Or if it gets more painful, again, that's a sign that we've got possible shoulder impingement. Another test we can do is we can kind of cross over here, and I'm going to come down here. I'm going to lift your elbow up, but at the same time I'm going to compress that joint. And again, if that's compressing that tendon, it's going to be quite painful. So those are some of the tests we can do to differentiate what's going on with your shoulder and make the diagnosis of a shoulder impingement syndrome.
Yeah. And once we kind of are working with shoulder impingement, we have lots of things we can do here at the clinic. We can do shockwave to help reduce inflammation, help break up that calcification. And then we also have ultrasound, laser, and we can use the IFC as well. But the main goal is to help reduce that inflammation and pain.
Yeah, we got to get that tendon kind of sliding through a lot easier.
Yeah. Okay.
And we also have some exercises. Once we get the inflammation down, we can actually start doing some exercises. We're going to show you some exercises you can do to help yourself.
Okay, so now we're going to go over some exercises that you can do to help with the shoulder impingement. So the first one is you want to make sure that your thumb is down and not directly in front of you. You want it out to the side a little bit. And with a band, you can have it anchored by standing on it or anchoring it to something down there. And you just want to lift your arm up like this. So that's strengthening that supraspinatus muscle that's running there. And so you can just slowly pull there like that, and making sure that your thumb is down and your arm is slightly out to the side. And then the next exercise is with your arm directly to the side, but your thumb is still going to be pointing downward. So you're going to go to the side like this. like that. And then the next exercise we can do is for rotating your arms. So we can tie the band to the door like this. Okay. And then, there we go. Okay. And then for this one, you want to make sure that your elbow is kind of anchored at your hip. It's staying nice and stable there. And you just want to focus on rotating your arm like this. Just like that. And then you can do it in the opposite direction, so the tension will be going outwards. Nice and slow, and then just making sure that your elbow is nice and anchored. So just focusing on that rotation right at your shoulder. Okay, and then the next exercise we can do is working on the shoulder gliding. So we're gonna stand at the wall. You can kind of think of this as like a wall snow angel. So you want to make sure your shoulders are flat against the wall and try to get your arms flat against the wall as well. And then we're just going to slowly glide our arms upwards, and that will help our shoulder and shoulder blade kind of work on gliding properly. So you can just go slowly up like this and down like that. Okay. And then another exercise we can do is work on shoulder retraction. So we want to think of squeezing our shoulder blades together. We also want to focus on not squeezing them upwards, so we want them to go back. So I can show it like this. So we want to go straight back, and then relax, straight back, and then relax, just like that. And then the last one we're going to do is for your pecs, we're going to stretch those. So then you can stand at a doorway, and then you just want to have your arm anchored on the door, and then you can slowly kind of push yourself forward, and you should feel that stretch right across that shoulder there. And you can hold that for probably 20 to 30 seconds. And then that's for your pec stretch. Hopefully those exercises helped you visualize how we can work on the shoulder impingement. You can do them for 10 reps twice a day. And thank you guys for watching this video. We hope you liked it. If you liked it, please remember to leave a like, and don't forget to subscribe. Leave a comment if you have any feedback. And as always at Goldsworthy Wellness, got your back.